Thank you, Mr. Chair. I want to thank you and the ranking member for having this hearing, and to our witnesses, thanks so much for being here. I want to start with a question to Mr. Thomas. As we have heard today, health system consolidation has led to unfair billing and pricing practices which drive up costs for patients. The law allows hospitals to charge facility fees to cover the cost of inpatient hospital care. And as some folks have already talked about this morning, some hospital groups are taking advantage of this when they buy and operate local physician practices. Now hospitals are charging unfair facility fees for routine care provided at a local physician's office, sometimes miles away from the actual hospital. Yesterday, I joined Senator Braun in introducing a bipartisan bill that would help end this unfair practice. It would cut costs for patients getting routine care and save the federal government billions of dollars. Mr. Thomas, as the CEO of an independent hospital, you've made the decision not to impose these unfair facility fees, as I understand it. In your view, how do these fees impact costs that patients face when getting routine care in the community?
Thank you for the question, Senator. At probably 12, 13 years ago, we started seeing physicians reach out to us having trouble maintaining their own practices and reaching out to community hospital to join community hospital. And as we explored whether we were going to set those clinics up as provider-based clinics, and I'm talking family practice physicians, orthopedic physicians, those outpatient clinics that were physician-driven, we made the decision to not make them provider-based physicians. I just didn't see in our community where I could look at a patient and on Friday say your bill was $150,
right,
and on Monday, because there was a different sign on the building, same chair, same doctor, that it was now going to be $350, $400.
Right.
And so we made the decision for our community not to do that. We've probably left significant dollars, and maybe I wouldn't be pushing Senator Bennett as hard to help me.
Right.
But it was a decision for our community. Now, at the same token, some of those we did make our oncology clinic a provider-based clinic. Okay. And the main reason we made that decision is because we also provide infusion services there.
Right.
So we're giving chemotherapy, and we have infusion nurses, and we have the chairs and all the things that go with those. And so the costs are higher in that clinic. Additionally, the reason we did that was because of the 340B program, which, right, guys, is a lifeline to a community hospital. We receive about $12 million in benefits through that program that get passed on to our patients. But without being a provider-based clinic at that location, we would have not been eligible for the 340B program. So we do have that, but that was a strategic decision that we made in our patient's best interest. It helped the hospital too.
Right.
But we just didn't feel like on those outpatient settings that were 10 miles away that there was really any difference the day on Friday when they were an independent practice to when on Monday it was owned by us.
Well, thank you for that. And Mr. Martin, I want to follow up on the same line with you from the perspective of a family physician. What happens to patients when their local doctor's offices are bought by hospital groups?
Well, I think there's two immediate impacts. I think one, their cost sharing goes up. Oftentimes, if with the facility fees and others, whatever the cost sharing would be in their program would be more, which Mr. Thomas just spoke to. I think another is that oftentimes the ability to seek and obtain services generally becomes more influenced by the institution, sometimes in the patient's behavior. Referrals can occur more quickly and sometimes not. Yeah. Because the clinical autonomy, again, is oftentimes run through a different filter than if the practice was completely independent and engaging with the patient.
Okay, so it definitely has an impact on the patient's experience, right? It's price, but it's also experience.
And I think that experience could be positive or negative, just depending upon the approach. I mean, I don't think it's always positive or always negative.
And I know, Mr. Thomas, you want to weigh in. Could you do it quickly? Because I wanted to get to a question for Dr. Cooper.
I just also want to, when we've acquired or these practices have joined us, we do have a challenge in the healthcare system because our costs go up. And I can tell you, every time I've recruited or a physician has joined us, the first thing after they sign their contract is they mention that their employees are underpaid and I should pay them more.
Okay.
They were paid okay when they were with them, but now with our overhead. Okay. So I think there's an argument for that there is increased cost when we take over these clinics. That was one of the things we were able to overcome. But guys, there is that tendency because now they have our benefits where before they may not have benefits. So thank you for the time.
Well, thank you. And Dr. Cooper, I was going to drill down on, follow up on something that Senator Brown was asking about, which is the role of private equity in healthcare costs. I'll just note for the record and then follow up with you that Senator Cassidy and I led on getting, along with Senator Bennett and others, the No Surprises Act passed, which takes the patients out of the middle of these disputes between insurers and providers. In the first year of the No Surprises Act, over 1/3 of all disputes initiated by healthcare providers come from companies owned by private equity firms, and a good portion of those disputes were really dismissed outright. So there is some concern that private equity is spending, they spent millions of dollars trying to block us from passing the bill. So I'll follow up with you about the influence of private equity on driving up patient costs in healthcare, and in particular in kind of creating this churn in the dispute resolution process. Thank you.
I thank my colleague, and I'm very glad that she and Senator Brown are digging into this private equity issue, and I know Senator Warren's been very interested in that over the years as well. Senator Warren.